Hello, my name is Shoshon Tama-Sweet. I'm the Vice President of Global Programs at Alliance for Children Everywhere, and I'm also the Director of our ACE Transition Partners Department. Alliance for Children Everywhere is really motivated by a very simple and clear belief, and it's the belief that children do best in families. We feel like families are the natural way for children to develop emotionally, cognitively, spiritually, relationally, and to be given the love that they need to become who they're supposed to be in the world. So at this point, ACE has grown to multiple countries in Africa. We've worked in Malawi and Zambia, we've worked in Zimbabwe, Mozambique, Kenya, Uganda, Liberia, Benin. And what we've seen is that working directly with institutions is an effective way to magnify our work and to really put some force behind this wave for family-based care, changing government policy, changing systems, and working with peers to create authentic local champions that understand that the best place for children is in families. So family-based care is wonderful for a number of reasons. First of all, for children to become healthy, functional adults, they need a strong, safe, trusting bond with a caring adult. And that really is not capable of happening within an institutional care setting because there's multiple adults that provide care, whether it's day to day, week to week, or year to year. And even with quote unquote family style situations where there's a house parent and several siblings together, what we found in practice is that house adult changes sometimes 2, 3, 4, 5, or more times in the course of a child's life. So imagine growing up and having 5 different parents. And at the end of the day, when the child leaves care, they never see any of those quote unquote parents again. And what children who've grown up in those family-like settings have told me is, in fact, those adults are there because they're getting paid to be there, and the children know it. So a safe, loving, and trusting bond rarely ever forms. And if it does form, it's broken and ceases to exist once the child is forced to leave the facility. So one of the things we've learned from our work is that between 70 and 80% of the children in an orphanage are not orphans. They have at least one living parent, if not both living parents. And what's motivating the family to give up that child is simply access to resources that they don't have: food, a bed, clothes, or education. The cost of getting those things is giving up your child to an institution. It's a choice that no parent should ever have to make. If a family needs access to food, there should be food programming for that family. If the family needs access to education, there should be access to education provided to that child within the family. And so a lot of our work at Alliance for Children Everywhere strengthens families so that children can stay with them. And I've seen it work at an incredible level. So at Alliance for Children Everywhere, we realized several years ago that the problem was bigger than us. And we were never going to magically be able to solve the needs for every child that we encountered in Zambia or in Southern Africa or in other countries. We made a decision about the strategy we were going to use to try to make sure that kids had safe, loving families. And the decision we made was to work with other ministries, with NGOs, and with government to try to change their practices around childcare. And the way we've done that is by creating ACE Transition Partners as a department. That department works as a consultancy to other ministries and NGOs in Southern Africa to help teach them about family-based care and transition from institutional care into support for families. It looks at preventing separation by keeping families strong. It looks at reintegrating children from orphanages into their families. And it looks at developing systems for adoption and foster care, for identifying and recruiting and training foster parents, and creating a system that's conducive to family-based care in the countries that we've worked in. So we think it's a model that works. It's one that we'd like to have grow. Sometimes it's a little bit hard to explain to everybody in a simple way, but we've seen it have tremendous impact, and we're deeply committed to the model of ACE Transition Partners.